Telehealth has been growing dramatically in recent years. The remote provision of clinical services via telecommunications technology is increasingly accepted by patients because of its convenience. Survey results from late 2016 found that two-thirds of consumers were willing to see a doctor over video. Insurers also are increasingly covering telehealth, and state laws and regulations are facilitating it. For example, a 2017 law made Texas the latest state to enable healthcare providers to establish a doctor-patient relationship by telehealth without an initial face-to-face meeting. Fair Health took a close look at telehealth in a recent white paper, which, in its second annual edition, drew on our database of billions of privately billed healthcare claim records to examine trends and patterns in healthcare places of service. We studied telehealth from many perspectives, including growth, geography, age, gender and diagnoses. Here are some of our findings. Double-digit growth. Nationally, private insurance claim lines for services rendered via telehealth as a percentage of all medical claim lines grew 1,202% from 2012 to 2017. A claim line is an individual procedure listed on an insurance claim. In the single year from 2016 to 2017, telehealth usage as measured by claim lines grew 53%, a rate greater than for any of the other venues of care we studied for that variable. By comparison, national usage of urgent care centers over the same time frame increased 14%, usage of retail clinics went up 7% and usage of ambulatory surgery centers increased 6%. Emergency room usage, meanwhile, decreased 2%. Still relatively limited. Even though telehealth usage has been growing quickly, the extent of that usage is still relatively limited. When examining the percentage of all medical claim lines attributed nationally in 2017 to use of each of the venues of care above, ERS held the highest place, with 2.6% of all medical claim lines. Comparable percentages for the other places of service were 1.2% for urgent care centers, 0.91% for ambulatory surgery centers, 0.11% for telehealth and 0.033% for retail clinics. Faster growth in urban areas. In recent years, telehealth has been growing more rapidly in urban areas than in rural areas. The rural increase in telehealth claim lines from 2012 to 2017 was 482%, compared with an increase in urban areas of 1,289%. From 2016 to 2017, rural growth was 29% and urban growth 55%. In 2017, the top 5 states for telehealth claim lines as a percentage of all medical claim lines were Oklahoma, Wyoming, Ohio, Hawaii, and West Virginia, in order from most to least. None of those states were among the top 5 in 2016 as reported in last year's The bottom 5 states in 2017 for telehealth claim lines as a percentage of all medical claim lines, in order from least to most, were New Jersey, Rhode Island, Nebraska, Connecticut and South Dakota. As in 2016, telehealth was most associated with individuals ages 31 to 60, who accounted for 44% of the distribution of claim lines with telehealth usage in 2017. Their share was smaller, however, than the previous year's 56%. Pediatric and young adult age groups made up larger shares than in the previous year. For example, the age group 0 to 10 accounted for 4% of telehealth claim lines in 2016 but 10% in 2017. Those ages 23 to 30 made up 10% of the distribution in 2016 but 12% in 2017. In 2017, claim lines with telehealth usage were submitted more for females than males in every age group except for children 0 to 10 years old. This fit a larger pattern. More claim lines were submitted for women than men in all adult age groups in the places of service in which we studied gender-related patterns: retail clinics, urgent care centers, telehealth, ambulatory surgery centers and mental health reasons, which had been the #1 diagnostic category for telehealth in 2016, were 5th in 2017, accounting for 7% of the distribution of claim lines. Common uses of telehealth expanded to include other types of diagnoses. The top 3 diagnostic categories associated with telehealth in 2017, each with 13% of claim lines, were injury, for example, contusions, open wounds, acute respiratory infections and digestive system issues, for example, gastroesophageal reflux disease, abdominal and pelvic pain. Neither injury nor digestive system issues had been among the top diagnostic categories in 2016. General signs and symptoms, for example, fever, headache, general malaise, were the 4th most common diagnostic category in 2017, accounting for 9% of telehealth usage. As our report shows, telehealth constitutes an important and evolving venue of care. We will continue to track its evolution,